Hi, I'm Brenda Orzetti, and I am nursing faculty at York University in the School of Nursing. I'm here with a colleague and a friend, Sandra Skerratt, who's going to talk to our nursing students about two different roles today, and that is of the nurse practitioner and global nursing role. Thank you for coming today, Sandra.
Thank you. Hi everyone. So I'm going to talk about the nurse practitioner role first. I've been a nurse practitioner for about 12 years now. So what is a nurse practitioner? So it is a nurse, you have to be an RN, who has got extra experience through university, and I will talk about how you become a nurse practitioner. So you are a registered nurse with advanced university education, and you need to be able to work independently but also collaboratively with your healthcare team. And you provide very holistic healthcare. So you're different from a physician in that they're very much focused on the medical side of patients, but coming from the nurse, you are seeing the patient through the nurse's eyes, and it's very holistic, your role. So what does a nurse practitioner do? So you provide care to individuals, communities, across the lifespan. So what would you do in your typical day? You would be diagnosing patients, you would be performing physical checkups, ordering and interpreting diagnostic tests, providing counseling and education. You would be referring patients to other specialists, prescribing medications. We tend to manage a lot of the chronic disease management, which is huge right now because of our aging population. You are allowed to now treat and transfer and discharge patients from hospitals. That was recently legislated. You can cast fractures, reduce locations, so someone who's had a fracture, and order blood products and things like that. So where do NPs work? So we work all across healthcare systems. So we work in hospitals as well as emergency departments. We work with family health teams. We work in family physician offices. We work in long-term care facilities. You may have heard of nurse-led clinics, which there are 25 right now in Ontario. We are starting to work in nurses and we're starting to work in schools and other workplaces. What are the benefits of nurse practitioners? So nursing has really fought for this role. And the benefits are that there are a number of patients who live in Ontario who don't have access to primary health care. And so we kind of take the pressure off the healthcare system by allowing patients to be seen by a nurse practitioner if there's not a physician available. And it also takes the pressure off physicians in that they can start to focus on more of the acute care patients, where we can take care of the more well patients and the chronic disease management patients. There are 4 nurse practitioner specialties. So you can be a nurse practitioner in primary care. You can be an adult nurse practitioner. You can be a pediatric nurse practitioner, and also a nurse practitioner in the field of anesthesia, which is very prevalent in the United States, but not so much in Canada. Now there's different education and universities for each of the fields of nurse practitioners. And so you need to decide from the beginning if you want to work in a hospital or you want to work in a community setting. If you want to work in a community setting, then there are 9 universities in Ontario that offer a primary healthcare certificate program. If you have a master's, it's only 1 year full-time. If you don't have a master's, then you need to do a master's plus your nurse practitioner certificate. So that can take an additional year. So 2 years total if you're coming with only a BSCN. If you want to become a nurse practitioner in a hospital and work in pediatrics or work in an adult population, say cardiology or oncology, then the only program that is offered in Ontario is through University of Toronto. And again, it's a combined master's and nurse practitioner program, which takes 2 years to complete full-time. The nurse practitioner anesthesia program is also offered at U of T, but at this time I do not recall of any jobs that are available to that role in Ontario. The second role I want to talk about is working in global health as a nurse. So as you know, global health is very there's a lot of awareness about global health right now, and what's happening in developing countries. And at York University right now, we have a full program dedicated to global health. For nursing, global health nursing can be a casual position, it can be a part-time, it can be a full-time position. I currently work in a casual position where I travel to West Africa once a year for 2 weeks, and I work with an entire medical team to provide primary health care to families and communities that never have access to any of this health care. And so you could be working with patients who are AIDS patients, who are stricken with malaria, and basically you're working with communities. You're not working for communities, you're working with communities. That's very important to understand, because when you go there, it's the community that will recognize the issues that they are having. It could be that their maternal mortality is very high. And you need to come up with a program on how to reduce maternal mortality. It could be because children are dying of diarrhea. So how do we teach families in the communities to prepare oral rehydration salts? We could be running vaccination clinics. So there are a variety of things that you can do working as a global health nurse. How do you become one? You need to have your BSCN, and you need to hook up with an organization that travels to these developing countries. And so there are a lot of non-governmental organizations that will take nurses to different countries. And you can also go to the International Center at York University and inquire about student international trips that are available. And the third way is to contact someone in the global health program. Now again, if you go as a casual position, it's a volunteer position, so you're not being paid, but what you gain from this is much more than what money can pay. But a part-time and full-time positions are obviously paid by organizations. So thank you for listening to the two roles of the nurse practitioner and the global health nurse. And I hope this will give you some enticement to go into these fields once you graduate.